Thanks for having me. Yeah, as David said, I am manager or director of pharmacy at the hospital here at National and Samaritan, and serve on the Mental Health Recovery Board and also on the county opiate task force. So I was telling David, I didn't realize I had not seen the movie prior to our training, and I had done the PowerPoint. And I just realized after seeing it a second time how much my presentation really corresponds with the movie, kind of emphasizing those points. So if you go ahead, Sally, and advance. I just wanted to give everybody some background real quick on the illicit drugs in Ohio and kind of current trends. So just dating back a little bit to 16, if everybody's heard, Ohio had more than 900 carfentanyl. So in the movie they talk a lot about fentanyl. Carfentanyl is that we hear about it as being the elephant tranquilizer. So it's usually used in veterinary medicine. I think we even had maybe a case or two here in National County of vet clinics getting broken into looking for carfentanyl. So Ohio had more than 900 carfentanyl cases reported. Florida was second with 100 cases. So good old Ohio led the way there. And then in 16, Ohio alone reported more than 1,700 opioid-related overdose deaths that were positive again for fentanyl. 1,100 of these were actually related to carfentanyl. And then Montgomery County, Ohio, which is down in the Dayton area, they have detected about 8 different fentanyl analogs and other synthetic opioids in the first 2 months of 17. So again, just giving you a little bit of background. Next slide. This is a busy slide, talks about the neurobiology of addiction. The most important thing here is that DA is kind of a dopamine receptor. So dopamine is really emphasized in the movie. And as you'll see in the next couple of slides, it really is all about dopamine. You can kind of see nicotine, alcohol, opiates, and again, alcohol, nicotine. And again, I'm not going to get into the details on this, but again, it really is about chemistry and dopamine in our brains and how opiate affects those. Next slide. And so the next couple of slides I'm going to emphasize, as they did in the movie, that it is about dopamine. So dopamine is that neurotransmitter in the brain that usually is just released naturally to relieve pain and cause pleasure. Opiates attach to these new receptors that we have in our brain, and it helps trigger that release of dopamine. Some opiates can trigger the release of up to 10 times more dopamine than what occurs naturally. Next slide. Again, it's funny because I have not seen this movie when I put this together, but just in doing my research, if opiates are used long-term, the human body and brain will actually compensate and decrease that natural release of dopamine. And then, as they talked about, that opiate withdrawal syndrome, abruptly stopping opiates causes extreme pain, and it has nothing to do with the pain that typically the patient was being treated for. It has to do it's all about withdrawal. And so people have stomach cramping, nausea, diarrhea, muscle cramping, shaking, irritability, insomnia. I know the one guy talked about the fact that he would throw things at you, you couldn't talk to him, you bite your head off. So those things really do happen. And it all has to do with dopamine. Next slide. This, I just wanted to kind of point out and show potency of opiates. So in the pink is oxycodone. So oxycodone is the drug that's in Percocet, or it can be given by itself just as oxycodone, or Oxycontin is long-acting oxycodone. So you can kind of see its potency there on the scale, along with morphine right beside it. As you move up, heroin is there in the blue, so obviously heroin is more potent. As you keep moving to the right, interestingly enough, hydromorphone is there on the right of heroin, which is actually Dilaudid that we use in the hospital system. And then you'll see fentanyl. You'll see how the potency of fentanyl is way more than the rest of those opioids to the left of it. And on a scale of fentanyl to carfentanyl, that is the difference in potency. So you can see why heroin laced with fentanyl or carfentanyl is very dangerous, very, very potent. Next slide. I just wanted to give you kind of a little perspective here when we talk about opiates that we use in the healthcare system, kind of how they compare as far as morphine and hydromorphone, which is Dilaudid. Oxycodone is there. Hydrocodone, which is the product that's in the Vicodin products, and then on down to pyridine and codeine. Next slide. So really, I think the most important part of the PowerPoint is really to talk about Narcan or naloxone. Again, naloxone is that antidote to opioid overdoses. You take too much of opioids, it can make actually your breathing slow down or actually stop. So respiratory arrest is what happens. So giving naloxone helps reverse this. Naloxone can prevent death and brain damage from lack of oxygen. Naloxone does not work though on non-opioids. So you can't give naloxone for cocaine overdoses or alcohol, chronic or acute alcohol intoxication. It only works on opioids. Next slide. Both naloxone and opioids bind to the same sites in the brain, those receptors in the brain that affect breathing. And so, luckily, naloxone actually binds more tightly, so it'll knock that opioid off the receptors, and it acts very quickly. Next slide, I think I have a picture coming up here. The body will break down through metabolism, break down a little bit of those opioids, and naloxone doesn't actually destroy the opioids. As I said, I'll show you how it kind of displaces it. If you get real large doses of opioids, you get that fentanyl in there, you get too much methadone, it actually can cause problems, or patients have liver disease. That's why we always recommend that you use at least 2 doses of naloxone and then actually call 111 and seek medical attention for an opioid overdose. Next slide. So here is actually a picture kind of showing the opioid is in the pink, the mu receptors are there in the green, and then the green bubbles are the naloxone, actually knocking the opioid off the receptor and displacing it. So that's what helps reverse those opioid overdoses. Next slide. How do we give naloxone? We can give it by an IM injection, we can give it IV in a vein, we can give it sub-Q if we have to, we can give it squirted in the nose. We train folks who, if anybody comes to the pharmacy, which I'll get into in a minute, we train folks that you can inject naloxone right through clothing, upper arm, upper leg, or even buttock. Next slide. And then I just have a few pictures of some Narcan and naloxone. This is name brand Narcan nasal spray. Comes in a 2-pack. As I said, most of the time we always dispense Narcan in at least a 2-pack. Next slide. This is what we actually dispense from the retail pharmacy there at Samaritan. This is actually an naloxone injection. But we put that little adapter on, the white adapter on the end of it. We actually give this intranasally, or you can give it intranasally. We realize that folks in the community may not feel comfortable giving an injection, and so sticking that adapter on the end of that, we just pull that yellow cap off and stick that adapter on. The bottom thing is the drug, and it screws in. You pop off the back of the yellow, it screws in there, and then you can just squirt it up in the nostrils. We realize that folks actually feel a lot more comfortable giving it nasally than giving it an injection. Next slide. This is actually just a smaller dose and vial of naloxone. We use a lot in the hospital, just showing that you can give that along with syringes too if you feel comfortable drawing it up and giving it IM or sub-Q. Next slide. That's all I had, but just a point about naloxone availability here in Ashland County. So I do know for sure that I believe all the pharmacies up in Ashland do dispense naloxone. Now, the State Board of Pharmacy here in Ohio did pass a rule where we have to have a protocol-based program that's actually supported by a local physician and allows us to dispense naloxone without a prescription. So you do not have to have a prescription to get naloxone. It can be billed to insurance if you want to. It doesn't have to be billed under, if a father, mother, sister, brother, aunt, uncle, friend comes in and thinks they need naloxone or Narcan for a friend, it can be billed under your name, under your insurance. You can pay cash for it. However, we can actually dispense it without a prescription. So the only thing I didn't check out is I'm not sure about Danner's here in town. I don't know if some folks know he does not. Okay. It's too bad, but yeah, go ahead.
Do our emergency services, are they authorized to use that if they encounter?
Absolutely. Actually, all of our EMS in the county carries plenty of naloxone, along with sheriff's deputies, Ashland City Police. Yeah, they all carry it, and have used it quite a bit.
What's the cost?
So the name brand nasal spray is very expensive. I'm not even sure we carry the name brand nasal spray. You're talking $300 to $400, I think, for a couple doses. We actually carry the injection that we train people. So if you pick up Narcan or naloxone at a pharmacy, it's required that you get trained how to use it. So we use the injection, train people how to put that little adapter on there and use it intranasally, along with, if you want the injection, we'll teach you how to use the injection. You're talking 80 to 100 bucks for a couple doses, and it always comes in a 2-pack. Sure.
What's its shelf life?
It's usually over a year, sometimes a couple of years you can get out of naloxone. Yeah. Steve?
Just wanted to mention, I understand too, that if you give naloxone and it was a misdiagnosed, it doesn't do any harm, is that correct?
Yeah, I'm glad you brought that up. Sure, naloxone is very safe, very safe. So if you give it in a person that has not overdosed or taken opioids, it's not going to hurt them. I don't know, some of you remember the incident over in Richland County where I think it maybe was THC or marijuana-laced candy. They automatically gave naloxone because they thought that's what it was. Those folks were not harmed by naloxone. Again, it's a very safe drug. If there's not opioids in there, it's not going to displace or really do anything. So, other questions or comments about naloxone or Narcan?